Good afternoon, everyone. This is Darlene with Generations Health. Thank you so much for joining us for our program, 5 Simple Steps for a Less Stressful Holiday Season, presented by Jennifer L. FitzPatrick. We are so grateful to have Artis Senior Living of Chestnut Ridge sponsoring today's program. And in just a couple moments, I'm going to ask Patty Pelican to join me to share a little bit of information with you. But first, there's a few things I need to cover. Right now and throughout the program, everyone is going to be muted, and that is simply to eliminate any background noise. However, this is interactive, and we do encourage your participation by asking questions, by answering questions, by sharing any comments that you have about the discussion that is taking place, and you can do so by utilizing the chat feature. If you have not yet found that, if you scroll across the bottom of your screen, you're going to see a little banner that pops up, and on that is a bubble that says chat. When you click chat, it will launch the chat feature, and it will most likely pop up on the right-hand side of your screen. Now, when you use chat with us today, your questions, comments, answers, those are only going to be seen by Patty with Artis, Jennifer, our presenter, and by me, and that is really for privacy. But Jen is great about going through the chat and making sure that she's addressing all of your comments, any questions that you have, and we do love to hear from you, so do answer any questions that she may ask of you. All right, again, please feel free to utilize that chat feature. As I mentioned, we are so grateful to have Artis Senior Living of Chestnut Ridge sponsoring today's program, and I would like to invite Patty Pelican to share her video with us so she can share a little bit of information with you about Artis. Patty?
Thank you so much, and welcome everyone. Thank you for joining our program today. Artis Senior Living provides memory care for people living with Alzheimer's and other forms of dementia and cognitive decline. Through our mission of compassionate, individualized care, our associates, residents, and their families join together to create a haven of dignity, empowerment, well-being, and comfort. The Artis philosophy is about human care versus memory care. Oftentimes, when memory care is the focus, it becomes about the negatives of the disease and the limitations. When you focus on caring for the human being, you focus on the whole person, their needs, their abilities, their possibilities, and their uniqueness. Thank you again, and thank you, Jennifer. We're so excited for this program today.
Great, thank you so much, Patty. And again, thank you, Artis Senior Living of Chestnut Ridge, for sponsoring today. All right, are you a little stressed out as a caregiver? Do you want ways to have a less stressful holiday season? If you answered yes to either of these questions, you're in the right place. Our presenter today is the author of Cruising Through Caregiving, Reducing the Stress of Caring for Your Loved One, and a longtime gerontology instructor at Johns Hopkins University's Certificate on Aging program. She has also been featured in national media such as CBS, ABC, Forbes, Reader's Digest, and Sirius XM. When she's not speaking and writing about healthcare, she can be found trying to resist the drive-thru at Chick-fil-A. Please join me in welcoming from Kent Island, Maryland, Jennifer L. FitzPatrick, MSW, LCSW-C, CSP.
Welcome, everybody, and thanks so much for joining us. 5 Simple Steps for Holiday Season. We are in the midst of the holiday season, but it's not too late to have a less stressful holiday season as a family caregiver. So we're going to talk about some ways that we can do that. The first thing we want to talk about is, what are your expectations? What are your expectations? Feel free to write in the chat section right now. If you have any thoughts, what are you expecting for the holidays? What do you want to have happen? What are you hoping for? This is a very strange year, and I get a year that many of us are really ready to let go of and move forward to 2021. And if you have expectations for the holidays, they're probably different from the year before or previous years. the holiday season has always been one of those sort of bittersweet times for many family members, because so many of us have these really high expectations. We're going to have fun, we're going to get along, we're going to have spiritual experiences, there's going to be gathering and great food, but sometimes we do feel let down. I think a lot of that actually comes from childhood. And we have that magic of the holiday season. So I think it's really important to just think about a word that you want to use as the theme for the holiday season going forward. Again, I know we're in the midst of the holiday season, but is it peace? Is it fun? Like your theme. So I'm actually going to go ahead and turn my video off because it looks like I'm having a little bit of trouble with the video. So I apologize about that. I'm going to try to put it back on in a little bit. So Mary says reflection. Still mourning the loss of her dad recently, and it's going to be a quiet celebration, and you want to use the word reflection. Renee tells us that she wants to provide supports to her caregivers that are taking care of their loved ones in hospice. But if anybody else has a word, the word that I am looking for this holiday season is peace, content, and peace. So what I want everybody to do is really just, even if you're not sharing it, just think about how do you want to feel during this holiday season? And when we get into the first of the year, what word do you want to help carry you through? So let's think and address the elephant in the room before we move forward. We're going to go through 5 steps. One is going to be considering the COVID risk. Patty says calm too. Okay. So we got reflection, calm, peace, contentedness. And if anybody else has a word that they would like to share, we'd love to hear from you. Joy. Ben's saying joy. That's a really great one. Enthusiastic. Great. Okay, so all of this is great. And for those of you who haven't written in, please feel free to write in. We're being asked by public officials and healthcare that we be very cautious this time of year because the vaccines are supposed to be right around the corner, and they're asking people to be careful about gathering. And I think it's really important. I'm going to try to keep my camera on for a little bit. I think it's really important for all of us to remember the COVID risk and know that not everybody is experiencing the situation in the exact same way. So everybody needs to remember that, okay, what your doctor tells you makes sense for you, or what, if your doctor's saying, hey, be really, really careful about being around others, depending on your loved one or your personal health risk factors. But it's so important to be considering your personal risk. And so not everybody's is exactly the same. One person who is maybe 25 is going to have a different risk tolerance than somebody who's 85 dealing with multiple health conditions. But that said, you also want to be considering and being mindful of the fact that maybe you will be even though your personal risk tolerance is more liberal, it might be that you're going to be seeing your loved one who has dementia, or you're going to be seeing somebody that does have some serious health conditions. So it's really, really important to just be thinking about the COVID risk as objectively as you possibly can for yourself and those who are in your circle, those that you plan to see, and decide what makes the most sense this holiday season. So for some people, a small gathering with trying to have ventilation and the windows open might make sense. Other people, maybe doing a virtual gathering is going to make sense. And again, only you can decide what makes sense for you, what is going to be the right decision for you and your family member. But you want to look at the information. You want to talk to your doctor. If you have an older loved one, which so many of you on this program do because you're family caregivers, talk to their doctor and think about what makes sense. But I think it's also really important to not just consider the physical repercussions of whatever you are going to do this holiday season, but also the mental health ones. And so maybe it wouldn't be safe, you wouldn't consider it to be a good risk or a smart decision to have 50 people or 30 people or even 10 people or 5 people gather for a holiday celebration. but perhaps you and your mom can maybe spend a couple of hours together with ventilation, or if you get one of those unseasonably warm days during this holiday season, to be outside, take a walk together, maybe visit from a window. But because you want to think about the mental health of your loved one too, the isolation that can occur. So just be thinking, and for some families, no contact visit is going to be the best thing, doing a drive-by, doing a window visit, something like that. But you want to be thinking about it from the holistic perspective, the physical repercussions, but also the mental health ones. And it's not just necessarily the mental health for maybe your loved one, it might be yours, for you, for your ability to feel peaceful or to feel joyful this holiday season. You want to maybe lay eyes on your loved one. And if your loved one is at an Artis Senior Living, it's so important to know what their rules and what their regulations are, and what kinds of precautions that you're going to be asked to be put into place, depending if you do actually do some sort of in-person visit or a drive-by or window visit or something like that. But you want to be thinking, because not everybody has the same exact risk tolerance, but you got to be thinking what is really logical, what makes sense for yourself and your family to keep everybody as safe physically, but also as mentally healthy as possible. So you want to be thinking about that. You want to, this is a weird year. This is something that we've never had to think about before. Step 2 in minimizing the challenges of this holiday season is reducing stress, is minimizing your fall risk. For all of us, as we age, we are more at risk for falls, and this has never been more true than, of course, in the wintertime, when it gets snowy, when it gets icy, when it's cold. But at the holidays, we also have the other issue of kids' toys and maybe all kinds of different decorations, new decorations that are around, furniture being moved. It's not where it usually is. This time of year, you want to be more careful than usual about fall risk. And why? You don't want to wind up in the hospital. You don't want your loved one in the hospital. We never want your loved one in the hospital. We never want you in the hospital. But this time, if you go to the hospital, it's going to be really tough to, some hospitals are not allowing even one caregiver to accompany you. Recently had friends of our family, the husband dropped off his wife at the hospital and he was not allowed in. And so, especially if your loved one has dementia and they have a fall, this is a bad time of year, a bad time to be making an unnecessary hospital risk. So you want to get up those rugs, the throw rugs. You want to be careful about kids' toys. You want to make sure that if your loved one and you are spending time together, that if their gait is unsteady, that you're guiding them. Because the last thing we want is for your loved one to be at the hospital without you. With our friends of the family that had to go to the hospital recently, it was very difficult, and she didn't even have dementia. He was calling her room and calling her cell phone, and it wasn't getting an answer, and was becoming really worried. And of course, she was just out getting tests done, but he actually wound up calling the nurse's station, and they said to him, well, what's your patient code? What's your wife's code? I can't confirm or deny that she's even a patient here at our hospital. And he says, what the heck do you mean patient code? I don't know. And so it was a very stressful situation for both of them. I can't imagine if she had dementia and had to go through all that by herself. So this is not the year that we want an unnecessary hospital visit. So be careful about toys. Be careful about dim lighting. I know at the holiday time, we love our candles, we love our lights, we love to dim the lights, but it's probably not a good idea. Be careful. Make sure there's plenty of lighting. Make sure that everything is shoveled. Make sure that we're putting the salt out if there's snow. I know a lot of our areas of the country are supposed to, especially New York, supposed to get snow this week. So we want to be so mindful and so careful, because this is not the time that anybody wants to fall. We don't want anybody to fall. We want to scam-proof our holiday season. Now, older adults are always vulnerable to scams. All people are vulnerable to scams. Smart, educated people, but the holiday season in particular is a time that the scam artists are working hard. And they are working hard. They're not working at a legitimate business like you or I might be, but they consider it a job. And a lot of them are very good at what they do. So think about it. If you or your loved one has been isolated and lonely, and maybe you wouldn't answer for a call that you didn't know who is on the other end, but right now you just want to talk to somebody. You want to be reiterating for yourself and your family members to not be answering phone calls from people who you don't know who it is. Even sometimes the scam artists are able to make the phone number look like a familiar number or a local number. Mail that comes in the mail this time of year. A lot of times charities trying to gain donations, sometimes they're legitimate charities, will make a request for a donation look like an invoice, and you don't necessarily have to pay that. You can decide, do you want to give to a certain charity? So it's really, really important, especially if your loved one with dementia, maybe they're in the early stages, maybe they're home by themselves still, and you're still trying to figure out what the next steps are. Know that just, of course, having dementia is going to make all of us more vulnerable to falling for a scam. But even those of us who do not have dementia, the crooks do not take off for the holiday season. In fact, right now, there's some really big scams related to, unfortunately, COVID vaccine. Oh, I've got you an early appointment for the COVID vaccine. You just have to give me your credit card for $50 and we'll hold the appointment for you. Or, oh, we're making sure that it's available to your whole family. You give us $1,000 and you'll get up to 10 doses. There are some very, very odd, or the COVID treatment. We have a special COVID treatment. So be mindful about phone calls and be mindful about mail that comes to the home that might be COVID specific or a scam. Joan is saying she got an email from someone I knew, but it had a period before their name, and they started with, "Hi there. The body of the email asked me to do them a favor. Do you have an Amazon account?" Absolutely. Joan, and people, it's smart, educated people fall for this, but even more so people with dementia will fall for this, especially if it looks familiar. Yeah, and you did the smart thing, Joan. You sent your friend a separate email and asked if she sent this. The reason that I bring this up as a way to reduce your holiday stress is because these folks, again, they don't take vacation at the holiday. They're still calling, they're still sending, they're still knocking at the door. Do you want me to shovel for you? Great, give me a deposit, and then you never see them again. You want me to help around with something in the house? So in terms of scam proofing your holiday season, if your loved one is able to reason, have those conversations. A lot of times if the dementia is advanced, they're probably not going to be able to reason, but you need to be that person's eyes and ears and be very, very cautious. But a good rule of thumb is we never want to, if it's an incoming call, and give you an example, the other day, one of my credit cards was actually compromised. And the credit card company called me and said, "I need your mother's maiden name." And I said, "No, you called me." And it actually was legitimate. My credit card was actually compromised, and I called back and on the 800 number from the back of the card. But my rule of thumb is if someone calls us directly or emails us or sends us mail or knocks on my door and I didn't make the overture, then I'm going to be much, much more cautious. I'm not going to give any personal identifying information. Another big scam that we see happening is the grandparent kidnapping scam. I have a friend of the family who fell for this and almost Western Union money. They knew where the grandson went to college. They said they had him. They had a kid screaming in the background, "Help me, grandfather." And he was such a wreck, but ready to go to Western Union and get the money. And even after he talked to his grandson on the phone, thankfully he called his son before he sent the money, Western Union. He still was shaky. He still couldn't believe it. So the reason that this is so important is because so many of us are lonely, we are isolated, and if we get a note from somebody that we haven't talked to in a while, or we get a direct message on Facebook, for example, of somebody, and it may be it looks like a friend, but it's really not their account. A lot of us are feeling lonely. A lot of us are feeling isolated. A lot of us, especially if we're not able to have the holiday we want, maybe with our risk profile, we've decided, you know what, We're not going to see anybody, even window visits. We're not going to do any of that. We just want to stay to ourselves. And somebody calls or somebody drops off a request for money. So this is in particular an important issue at the holidays during COVID, when everyone's anxious and stressed and frustrated. It's tough. Interesting. We have another comment. I had someone call and say they knew I had neck and back pain. I asked them how they got this information and they hung up. Wow, Joan, you are good and you're not falling for this. What I would really recommend, again, if it's incoming call and you don't know who it is or you didn't initiate it, be careful. Be really careful. And like the example that I just shared with you about my credit card company, even though it was legitimate, it can be legitimate. They asked me for personal information. I said, you know what, I'm going to initiate the call. So we want to be really, really careful about scam proofing our holiday season. Be mindful of your loved one who has dementia. Your loved one who has dementia needs special considerations. He or she probably does not remember that there's a pandemic. Now, if that person is in the early stages of the disease, they might realize it, and they might have moments where they forget, but then they realize it. We want to be so careful about giving them too much information. It's just like with small kids. Now, the person with dementia, of course, is a grown-up. I write a whole chapter in Cruising Through Caregiving about the person is an adult. They're a grown-up, absolutely. But a lot of their behaviors, and if we give a small child, maybe a 2 or 3-year-old, we keep saying there's a pandemic, lots of people are dying, that's going to scare them. Their brain is not able to conceptualize all that we're telling them. When somebody has dementia, their brain is going to be overloaded with fear. And think about when you first heard the word pandemic back in March. It wasn't a great moment. We were scared, we were nervous, we were anxious. Of course, we've learned a lot since then, but we don't want to give too much information to the person who has dementia. And I think a lot of times families right now, if you decided you're not going to see your loved one because you feel like it's too risky, you're not even going to do it with any safety precautions, you might be feeling like you have to make a lot of excuses, that you have to make a lot of details, like, Mom, there's a pandemic. I don't want you to die. I don't want to get sick. When we put that imagery in our loved one's head, think about how tough it is for you to deal with that information, and you don't have dementia. If your loved one has dementia, then it's going to be even tougher for them to manage that. And you're probably going to get a very fearful response. They might say no. They might be very angry, say you're just making excuses. It might be really easy to just say that there's a bug going around or there's a virus going around. But we want to just be so careful that if you let your guilt turn into that, you feel like you have to over-explain yourself. I feel like we do that a lot. And even before the pandemic, a lot of family caregivers, if they weren't able to visit because maybe they had a sick kid at home or they had a work trip that they needed to go on, and they would want to get into elaborate conversation, Mom, and they're on the phone or maybe they're on a Zoom call and they want to get into all kinds of detail. And it turns out that their loved one just can't follow, especially if they're mid-stage or later. Deal with your guilt yourself. Don't try to explain away why you can't visit at the holidays or why you're not able to have the same family functions or parties or what have you. Be careful. Just say, Mom, you know what? I'm gonna come another time, or I'm sending your gifts because I'm out of town. Maybe you might use a therapeutic fib, but be mindful that you can go see a psychotherapist. You can go to a support group. You can talk through your stress and your guilt and your feelings with a friend. But if we lay all of that excuses in the pandemic and we don't want to travel and we don't want to get you sick, we're filling your loved one's mind up. Your loved one's mind is already cluttered and dealing with so much upon them, dealing with the dementia diagnosis. We just want to give it simple explanations. I'm sorry I'm not going to be able to make it, but there's several presents coming from you. We're going to talk on the phone. We're going to look at each other on a video call. Now, with the video calls with Zoom, it's wonderful. Actually, Joan is saying, this is a great example. Joan is saying that her husband asked her, what program are you attending today? And she said one on aging, not one on dementia. And that's so smart, Joan, because it might be upsetting to him. Why, does he even remember that he has dementia? Or why would you need to be on a dementia program? Why do you need support about me? But we want to be mindful that your loved one with dementia, this pandemic has been hard on everybody. All of us are having different feelings. Some of us are very sad and depressed. And I just was doing a radio interview with a channel in Canada, and the interviewer said to me, it seems like everyone has low-grade depression right now. And I said, it's interesting because I don't think everyone has low-grade depression. I think there's a lot of different kinds of difficult feelings people are experiencing. Most people will tell you they're experiencing difficult feelings, but some people, they're not necessarily sad or depressed. They're just anxious, they're nervous, they're tense, they're worried. And some people are angry. Some people feel like there's too many restrictions and why can't life go back to normal? Some people are just frustrated. Some people feel they're impatient. They feel like this vaccine business is taking too long. So we want to be so careful about putting all of that on our loved one. The other thing that I want you to think about is if you're not celebrating in person, which many people are not, a lot of us, our tendency is to go to the Zoom, to go to the FaceTime, to go to the Skype, and that's great. It's so lovely to see each other's faces. Over the weekend, my cousin is having a baby, and over the weekend, she did her gender reveal on Zoom, and it was great. It was, we all so wish that we were all together, but it was better than having to do it over the phone or something like that, right? But think about it, if your loved one has dementia, if we put somebody with dementia on that Zoom the other night for the gender reveal, I bet that they would have been very confused. Why are we on this? Who are all these people? To be honest, my cousin and her husband, it was my cousin and my side of the family, then her husband's side of the family, then there were friends of theirs. So there were probably about 20 people on this Zoom call. And, it's very confusing. Like, my husband always jokes, it's like the Brady Bunch. You got once you get 9 people, okay, you can see everybody, but then all of a sudden, you can't. You get more than 9 people and it's like people disappear, people show back up. I'm sure you all know what I'm talking about because you've probably done your fair share of Zooming this year. But the problem with this is that can be very stressful and very distracting. Remember, your loved one who has dementia, his or her mind is already playing tricks on them. They have hallucinations. They have delusions. They're sometimes seeing things that aren't there. They're believing things that are not true. It's so, so important to really think critically. Is a FaceTime, is a Zoom? Now, how can you do that? What are some ways that you can determine if your loved one is going to be a good candidate for Zoom? Well, for one, for a lot of people, if your loved one is somebody who looks at the television and thinks that the people on TV are in the room with them, it might be somebody that's not going to be a good candidate for Zoom. If they look distressed, if they're not participating, if they're frowning, if they're grimacing when they're on the Zoom, they might not be a good candidate. It might be a good idea to stop. Don't underestimate the power of a simple phone call. For a lot of older adults, that is more familiar. That is more comfortable. Picking up a phone and hearing a loved one's voice, that is going to be, it's going to be in their long-term memory. It's going to be easier for them to handle. Now, there are some people who have Alzheimer's and other types of dementia who do great with Zoom. So I'm not saying don't try it, but even if you try it once and it doesn't go well, I'm not saying don't try it a second time, but don't push that agenda if your loved one doesn't seem to be responding well to it. Years ago, I remember working with a family where the wife was saying that every day when they were getting ready for the morning, getting dressed, her husband would take his clothing and go into the hall bathroom to get changed. And she could not figure out why. And he was still verbal. And at one point, he said to her, she asked him, and he finally was able to verbally express, oh, I don't want those people to see me change. And he was talking about people that were on the Today Show or Good Morning America or one of the morning shows that she had on. She never thought anything about it. She just thought, I've got my morning routine. I'm watching my morning show. We're getting ready for the day. And her poor husband thought he had to go into a whole other bathroom to make sure no one saw him. And so if you've got a loved one like that struggles with television, they probably are going to have challenges with Zooming, with FaceTime. The other thing that can be really scary and stressful for them is when they see their own face. Now, probably a lot of us have gotten used to, you see yourself on the screen. It's a little weird. It's a little awkward. It's a little funny, but we're used to it now, most of us who use Zoom on a regular basis. But imagine you are somebody with dementia and your brain is constantly playing tricks on you. Is that really a good idea? Is that really a good idea for you to be, seeing other people and then also seeing yourself? So I'm not saying don't do it, just be mindful about it. Does it make sense for your loved one? If you are at home with your loved one, or if you are at a gathering with your loved one who has dementia, some other areas we want to be super mindful of are making sure that that person, if there are many people gathered, and even if it's a small group, maybe it's 5 people, 5 family members, 5 friends, know that your loved one, if that's not part of his or her normal routine, they're probably going to need breaks. They're going to probably need some time alone. A lot of persons with dementia do great. They absolutely love that when the grandkids are there, or they love being around several different people. It's fun for them. It's familiar. But many people do not do well when it's more than 1 or 2 people around. Many people struggle with that. So you want to make sure there's breaks. Maybe take them for a walk. Make sure that they're getting exercise. If you are gathering, or if you are doing something that is festive for the holidays, that's going to take your loved one out of his or her normal routine, as much as possible, you want to keep certain parts of their routine sacrosanct. So when they get their medicine, keeping mealtime, making sure that they get some exercise, whether you're going to take a walk or whether you're stretching, you want to make sure that they're trying to keep a schedule with sleep, because all of that is so important to them being able to function properly and have the best outcome if you do something festive that's outside their normal routine. So just be really, really mindful. Your loved one with dementia, of course, they're an adult, of course, they're a grown-up, but if you are in a situation with them, just know that there's anything you can do to keep their routine solid, anything that you can do to minimize a lot of noise or distractions, loud noises. For example, if you're watching a Christmas movie or a holiday movie, or you've got really loud holiday music on, some people are going to embrace it. Some people with dementia will embrace it. Some people, it's going to be overwhelming. It's going to be too much. The lights are too much. The flickering is too much. And again, we talked about, you want to be careful about that because we want to reduce fall risk. But be really mindful about that. And if your loved one is at a senior living community like Artis, trust that the community that you have selected is doing as much as they can to make sure that your loved one has a good holiday, if they are going to be remaining at their community, which a lot of people are going to opt for that. You also don't want to beat yourself up too much if you are opting for that option. If your loved one's going to stay at the community and they're going to do the holiday dinner at the community, the New Year's Eve party at the community, and you can't be there and they can't be with you, try not to beat yourself up too much about it. A lot of times your loved one does not realize that that's the actual date of, say, New Year's or Christmas or the dates of Hanukkah. They know that it's a festive time, but they might not realize it's the actual day. In terms of gifts for your loved one who has dementia, make sure that they're gifts that are simple for them to open. If you're sending a package, try to make sure it's something simple for them that they can open, and think about what makes sense for them. What are they enjoying right now? Probably for someone with advanced dementia, getting them a book might not be such a good idea, but maybe loading up an iPod with music that is in their long-term memory. Might be something, if they have an iPad or a speaker that can be hooked up with that, it's going to be offering them all kinds of reminiscence, and it would be great memories. So music is typically music, old movies, anything that's in that person's long-term memory, anything related to that, or something that is going to be pleasing tactile wise, like maybe a very soft sweater or something like that. Just be mindful that a lot of the way that the person with dementia is going to be enjoying themselves is through the senses. And know that if you do engage with your loved one, whether it be phone, whether it be Zoom, whether you actually are in person, spending time together or reminiscing, looking at old photographs, watching an old movie, listening to holiday music, that's probably going to be more effective than having conversations. Now, especially if somebody's in the advanced stage. I'm actually going to shut off my video because it seems like it's giving me a little bit of trouble again. Sorry about that. But just be mindful that everybody who has dementia is going to be different. Some people are going to be more talkative than others. And if you are spending time together, doing an activity or listening to music or watching a football game, a bowl game, or all of that engagement is going to be more effective typically than asking them questions. Probably many of you have had the experience that if you ask a kid, what did they do at school today? What did you learn today? They, well, especially back in normal times, they oftentimes don't really have a lot to say. And I feel like a lot of us struggle with that when we have somebody with dementia in our lives. We want to ask them questions. What did you do for dinner? What did you do today? And we think that that's a way to engage. Sometimes just sharing what you're up to, what your life has been like, what the kids got as presents. And know that your loved one might not be able to give you the response that you necessarily desire. You might say, oh, the kids got the baby Yoda this year that they really wanted. And they might say lamp. And it might not be that they're not listening. It might not be that they're trying to be rude. They don't have the right word at their disposal anymore because of dementia. Feel free to write in any comments, any questions at all. If you have any, we'd love to hear your examples. What do you have planned for this holiday season? What are you looking forward to doing to celebrate? If your word for this holiday season is content or relaxing or peaceful or healthy, what are you going to do to get there? What are your plans? Consider your silver linings. Now, I know that this is a tall order right now. It's very tough. A lot of us are very focused on what we don't have and what we're missing. And my goodness, I'm a caregiver for my mom who has dementia. I'm trying to homeschool my kids. I'm trying to work from home. My spouse is using up all the internet and my kids are using up the rest of it. And so we have a lot that we're not happy about right now. All the stuff that we're hearing about COVID, it's constantly changing. It's very easy to get into a place of frustration or bitterness or anger. And believe me, I'm not saying that I'm above that. We all have had our moments these last 10 months. But it can be very, very therapeutic if you're a family caregiver to be thinking about what are your silver linings during this time. And if you have one, I'd really love for you to share it. What are your silver linings during this time? So I'm going to put that in the chat section and challenge you to think. And if you don't have any, if you truly feel like you don't have any, you can share that too. This is a safe place to share that. I recently I was a keynote speaker for a hospice conference. And I did a survey with all the participants ahead of time. And all nurses and social workers and nursing assistants and nurse practitioners, all of these different professionals. And it broke my heart because about 10% of the audience said they have had no silver linings during this time. And if you know people who work in hospice, they tend to be some of the most positive, hopeful people. And it was just heartbreaking. So if you don't have a silver lining, that's okay. But I want you to really be thinking about, what are you going to do to take care of yourself right now? If you truly don't have a silver lining. And what I'm saying to you is, you want to, if you're caregiving, and if you're a sandwich generation caregiver, you got children, or, you know, maybe you're exhausted, maybe you're dealing with financial stresses because you were furloughed, or your industry's been really hit hard. What can you do to take care of yourself? Whether it's taking a bath, whether it's setting aside time to read, whether it's attending spiritual services online. But if you truly feel like you can't figure out even one silver lining, it's so important to figure out how you're going to care for yourself. Now, Joan says she knits, and it's a form of meditation. I think that's wonderful. That's a great silver lining, that you're able to spend time knitting. Mary's saying her silver lining is she's thankful that no one in her family has COVID. All of her family and friends are healthy. Ben says, I enjoy the memories remembered as I decorate and get out my family ornaments to make my home a place of comfort, and you're a home alone. Okay, Ben, that's really beautiful, because a lot of people would focus on, I'm home alone. And you're focusing on, not to say that you probably don't have moments, a lot of us do have moments where we're sad or we feel low, especially right now, but that to make that your viewpoint, your point of view, your way of thinking about it, enjoying the memories as you decorate and you get out your family ornaments, I think that's really fantastic and just really, truly inspirational. For my silver lining, I will tell you that for years, especially during the winter, I would say to my husband, gosh, I wish, I live in Maryland, and when it snows in Maryland, everything sort of shuts down, and people are just reluctant to go out, and everybody sort of hunkers down and grabs food and toilet paper, and kind of much like the beginning of the pandemic. And I remember years and years saying to my husband, gosh, I wish we would just get like a bad snowstorm for 2 weeks so we didn't have to leave the house. We could just be home, that we, had an excuse. We didn't have to go anywhere. We didn't have to really do anything. We could be in our pajamas all the time. And I swear, I really said this to my husband for so many years. I wish everything on my schedule would get canceled for a week or two. Well, my wish came true times a lot more than a week or two. And I try to remember that that's a silver lining. One of the silver linings I'm trying to focus on is my husband and I are eating healthier. We are exercising a ton. We are really enjoying, for the most part, spending time together, although we've definitely had our moments, as probably many of you have. But having some sort of silver lining, I'm so hopeful that we're getting toward the end of this with the vaccine coming, and the data that most people do have very mild cases, not everybody, but there's a lot of hopeful news that many people have recovered. Far more people have recovered than have passed away from COVID. I feel grateful for that, as much as it's sad and tragic, the people who have passed away and all the healthcare workers who are essential that are doing so much. Grateful that hospitals haven't been overrun. It's another silver lining that I try to think about. But if you truly can't come up with a silver lining, it's so critical to be thinking about, what can you do for your self-care? What do you need to do for you? Because if you're on this program and you're a family caregiver, you're taking care of other people, plus maybe you have a job, maybe you have kids that you're trying to homeschool, and you feel like you're losing it, you have got to carve out something for yourself. What's going to be just for you? Is it binging on Netflix? Is it going to be taking an online class? Is it going to be making sure that you exercise? But is it going to be meditating? What is something is it learning a new skill? What is it that you can do right now to just make yourself feel a little bit better? On a scale of 0 being you're experiencing no stress, and 100 being your stress level is at the highest during this holiday season, where are you? So I'd like to ask you to write in 0 being you have 0 stress, no stress, you feel perfectly fine, no problems, and 100, 7. Okay, So that's actually pretty low. That's pretty good for you, Mary. If you are over a 50 or over even a 40, I would strongly recommend that you go back to that word. What word do you want to associate with this 2020 crazy holiday season? Is it comfort? Is it relaxing? Is it health? What do you want to associate? And you need to take the steps to make that happen for yourself. What are you going to do to try to get that for yourself? And it's great because Mary's sharing that she has boundaries, setting good boundaries. Now, the other thing that's important to remember is right now, no matter what you choose to do, no matter what you choose, and Ben's saying he's pretty low. He's about a 7 too. Now remember, everybody, I want to make sure everybody's clear. I said 0 to 100, not 0 to 10. Either you're very, very low or you're very, very high. So on a 0 to 100, if you're saying 7, that's on a scale of 0 to 100, that's very low, and that's low stress, which is wonderful. I also want to just mention, oops, Mary says 70. Okay. So Mary, I really just encourage you to say, what am I going to do different? What am I going to pull back on? How am I going to have better boundaries? And speaking of boundaries, especially if you're caring for someone who has dementia, whether that person is at an Artis Senior Living, or whether that person lives with you, or whether they live in another town or far away from you, remember that other people might be passing judgment during this time about how you're managing the holidays, but only you know what is right for you and your loved one. So some people might say, maybe you've done your risk assessment and you said, we're going to have a small gathering at my house, and we're going to have ventilation, and we're going to keep it to a short period of time. Now, there might be family and friends and neighbors that judge that and say, well, I can't believe it. You have an elderly loved one. Why, I can't believe you're doing that. Just know that you have to do what's right for you. On the flip side, you might hear family or friends or neighbors judging, you didn't take your mom out of Artis for the holidays? Oh my gosh, I could never leave my mother in a senior living community over the holidays. So just do your own risk assessment. Decide what makes sense for you and your loved one with, of course, the proper precautions. But know that it's you and your family. If other people are judging, if you're making decisions thinking about what your doctors say and what makes the most sense, try to just let it go and let people who maybe are judgmental or who are questioning the way you're handling things. No one is handling this pandemic perfectly. It's interesting, Mary, because you sit here at a 70. Ben says, no, he really is at a 7. COVID has taught him a lot about the positives of being alone. It's my choice to make it alone and not lonely. Beautifully, beautifully said. So remember, beyond the holidays, we're going to enter a new year. Let's have a lot of hope for the vaccine and for life getting back to some semblance of normal. But use this holiday season to think about, what do you want? How do you want to experience it? And think about how you want to carry that through to caregiving for a loved one who has dementia in the new year. Thank you all so much. I want to try to jump on another moment to say hi and goodbye. I'm so sorry I was having issues with my camera, but we do have a few moments if anyone would like to ask any questions or make any comments at all. And I'm sure Patty is going to say a little bit more to us. If you would like a free chapter of Cruising Through Caregiving plus all the worksheets, just go to cruisingthroughcaregiving.com. And I'm going to invite Patty to join us and have any last words. And there is an evaluation we're going to ask you to fill out just so we can give feedback about today's program. Thank you all, and I wish you a very, very happy, peaceful, healthy holiday season.
Thank you so much, Jennifer. That was really some great reminders there and great information. I wanted to just say a little bit about how Artis Senior Living can support you now. Maybe a phone discussion about caring for a loved one with dementia would be supportive to you or to someone you know. Perhaps scheduling a virtual visit from the comfort of your own home is something that you'd like to explore. Feel free to pick up the phone and give me a call. My name is Patty Pelican. I am the Director of Marketing. You can reach me at 845-920-8341. And also wanted to tell you about a really special program we have coming up, and I want you to save the date. It's Tuesday, December 29th from 6 to 7 p.m. And it's a program with our Artis Safety Council featuring physicians from Johns Hopkins, and they're going to be talking about why the COVID-19 cases are surging. And they're going to spend also a lot of time on vaccine data, distribution, and safety concerns. And the format for this Zoom, it'll be a Zoom meeting, but it'll be a webinar format similar to today, where we'll see only the speakers, but we can ask those questions in the chat section, and there will be a facilitator making sure all of the questions are addressed by the physicians at Johns Hopkins. So to register for this program, you would simply go to theartisway.com/safe living. So thank you so much. Thank you, Jennifer and Darlene, for this wonderful program. Wishing you all a very safe holiday season. Thank you.
Thank you so much, Patty. And thank you again, Artis Senior Living of Chestnut Ridge, for sponsoring today. I hope that you enjoyed today's program. I did put a link into the chat that will take you to a very quick evaluation. If you wouldn't mind clicking on that and letting us know what you thought, it would be appreciated. Thank you again for your time today. We appreciate you and all that you do. We hope that you have a wonderful holiday season, and we will look forward to seeing you in the new year or with Artis on the 29th. Have a wonderful afternoon. Take care.